Previously on Health Now.
So, one child we may say, this is the food you're supposed to take to be able to treat your seizure. Food is also treatment.
Yeah.
Yes. For another one, we'll say, don't use this drug, it will make the seizures worse, use this other drug. So based on the tests, the EEG, then we can be able to guide ourselves into management.
Okay. Our viewer, as we talked in our last episode on epilepsy in children, we said that we didn't complete on the causes of epilepsy. And this episode, we are going to continue with Dr. Maureen on the causes. And then we'll move on to how we can manage epilepsy in children. Daktari, karibu.
Thank you so much. Asante sana.
Yeah.
Yes, so the last time we left off with the causes of epilepsy, and there's one major cause of epilepsy, which is something we call perinatal asphyxia. So when children are born, if they do not cry immediately, meaning that they do not take that first breath when they're supposed to, then the oxygen they don't get enough oxygen in their brain. So this can be a cause of epilepsy in these children. So it is very important, for a pregnant mother to make sure that they follow up with the antenatal visits.
Probably the time you look into this camera.
Yes.
And talk to this parent who is probably expectant.
Okay.
Yeah.
First, congratulations.
Yeah.
Expectant.
Yeah.
It's a blessing.
Yeah.
So if you're planning a pregnancy or you're pregnant, the most important thing is that you have to follow up with your antenatal clinic visits. And then when you get the labor pains, you have to go to hospital so that they can be able to monitor labor and make sure that there is nothing that is going wrong, and that when the baby is born, they are able to take their first breath when they are supposed to. And for the complicated cases, I'm sure Dr. Maina has talked about it here, the ones who need to go for a cesarean section.
Yeah.
It's important to liaise with the obstetrician and gynecologist so that they can be able to institute the management that is required appropriately, so that we do not get these cases of children who have asphyxia, meaning that they're not able to get oxygen in their brain, and now, they have epilepsy. They start convulsing very, soon after, and then they have, a long-standing history now of epilepsy.
Okay.
Yes, so it's quite sad that these cases are there in the first place, but it's very preventable. Just make sure that you go for your clinic visits and make sure that you're following up with a gynecologist, obstetrician gynecologist, so that your labor is monitored, so that if a cesarean is needed, it's done on time, and make sure that if you can, then you have that baby in hospital, so that if everything was done correctly but the patient still needs that resuscitation immediately after birth, you're with healthcare professionals who are aware of what to do with the baby at that time.
So what I'm hearing you, Dr. say, is that if a child does not cry, probably I don't know whether minutes or seconds after birth, a parent should be concerned.
Yes, a parent should be concerned if the baby does not cry immediately. So usually we time it according to the first minute, the 5th minute, and the 10th minute. The critical one is the one at 5 minutes. So at immediately the child is born, a pediatrician monitors how is the baby, what is the color of the baby, is the baby crying immediately, what is the heart rate. So all these things are important because if that baby doesn't take the breath that is required, immediately or within that critical time period of 5 minutes, then they have a higher chance of getting epilepsy. And on top of that, cerebral palsy, which is It's a chronic condition. It's a long time condition of having motor difficulties in the baby. So, and it's very preventable, very, very preventable. Yes.
Okay. Wow. Tuendelee. Tunasoma. Tunasoma.
Yes.
Yes.
So, so in terms, to go to treatment. In terms of treatment, there are very many types of treatment.
Okay.
That we give. So maybe we'll talk about now the causes. Being whatever has caused it is what we are trying to treat. So for the structural ones, where maybe they need surgery, we liaise with the neurosurgeons, and then that area that is the focus of the epileptic activity can be removed. Yeah.
How early can that be done on a child?
So it depends on what the type of the tumor is, and it also depends, on the neurosurgeon. Now that one now we usually hand over to the neurosurgeons to take care of that. Now, in terms of management of epilepsy, we have different drugs for it. So there are different types depending on the different types of seizure types that you have. If you're having, a focal seizure means that only one part of your body is affected, and if the activity is secondary to a half of your brain, one part of your brain is the one that is producing this electrical activity, then there are specific drugs for focal seizures. If you have the activity coming from both sides of your brain, then there are those drugs that we classify for generalized epilepsy, whereby both sides of your brain are firing. We also have, so those are drugs. We can also use food. Yes. So for specific types of seizures, as we had mentioned in the last segment, there is epilepsy that can be caused by lack of metabolism of your vitamins.
Yeah.
So vitamins, specific. So it's not the over-the-counter vitamins where you go and buy the package. No.
Yeah.
We give you high doses that can be able to manage this. So we'll give you probably a high dose of a vitamin that we feel is the one that is causing you to have this epilepsy. And everything is poisonous. So kindly do not treat yourself at home. High doses of anything is poisonous. So usually it's we monitor very closely. And in any case, these cases are not as common. So we do a lot of monitoring. We also have some seizure types, some convulsions that can be treated with food. So I'm sure everybody now, there's this whole thing about the ketogenic diet. So yes, we do use a ketogenic diet for some epilepsies, but then again, it's for specific types of epilepsies. It doesn't work for every type, it's for specific types. And kindly do not use the ketogenic diet that you're giving to lose weight, because I know some people there was this whole fad about people using ketogenic diet to lose weight. Please don't use that on your children. They will lose calories, they will get even more convulsions. So the diet that we usually give is a very particular type of diet that we work closely with a nutritionist, so that we can be able to check the calories, because children need to gain weight. We are not trying to make these children lose weight.
Yeah.
So we need them to gain weight, but still control their seizures. Yes. So the treatments, are varied. Yes.
So what I'm hearing you say, that is when you're managing with food, it's also important that you get nutritional advice.
Yes.
So that you don't do it your own way and then make the situation worse. That's what I'm hearing you say.
That is very true, because you can actually make the situation worse, and usually it is the neurologist who is going to prescribe this food, because again, it's not every type of epilepsy that can be cured with food. There's a group of epilepsies that usually respond to the type of diet, and they're usually the severe sort of epilepsies. And I don't think that everybody should, be running to food in terms of like curing or treating epilepsy. I think maybe at this point it's important for me to let you know that epilepsy, 70% of epilepsies can be managed. As in, you can give treatment, and then 70% of children get off the medication and don't get epilepsy again.
Wow.
Yes.
That's very encouraging.
It is. I think it's the best thing. Epilepsy sort of, when somebody hears epilepsy, they think, oh, you are going to live with it forever. Mm-hmm. There is no treatment. Mm-hmm. This is it. Mm-hmm. But 70% of it, they come and it goes. Mm-hmm. Yeah, and it doesn't have to be this secret or this debilitating thing. You can get treatment for it, and we can put you on medication and then remove the medication, and then you stay alive without medication and without epilepsy.
Oh,
yes.
So you don't have, like, if you're started on medication,
mm-hmm.
you go throughout your life with medication?
No. Not all epilepsies need lifetime medication. And the best thing about children is that children are resilient. Children's epilepsies can be managed. And again, a very large group of them will just come and go. You will be talking about it years later. Oh, this happened, but we don't have it anymore. So children are a special group who we can actually treat, and everything just goes back the way it was.
I think that's a lot of hope.
Yes.
And I think that is very important to our viewer, that it can go.
Yes.
Somebody may think, now that my child is being treated for epilepsy,
yes,
I'll continue with drugs forever, even as a child. That kind of a fear in parents. But I'm really getting encouraged that there is hope on that.
There is.
Yeah, let's go on.
And it's not, epilepsy shouldn't be, it's not a life sentence, and then there's this misconception that, if a child has epilepsy, then they are not intelligent, or they cannot do what other children are doing. I mean, there are children who are A students and they have epilepsy. It really doesn't mean that a child who, has epilepsy is mentally retarded or does not, can't go to school well, not at all. Yeah. So for these children, we usually can manage them. And then, the epilepsy is controlled. So usually give the treatment for a particular period, and then after that, now we start, of course, during this period we are monitoring, and then when we are seizure-free, then we start removing the medication slowly, so that we don't also trigger the convulsion, and then the child can stay without the medication. So, and then because as we mentioned about the different types of epilepsies, there are these epilepsies that usually come for children between around 6, 9, 10 years of age. Those ones usually end by themselves. You can have a child having one convulsion, and then the next one will be, years later or months later. For some, we know that they will end at some point. So even if we start treatment, we are very sure that the outcome will be good. And that's why for most children, they end up without having treatment later in life, without needing treatment later in life. So you shouldn't feel bad that, this is happening. I think the biggest thing is to make sure that you get medical advice, so that treatment is started early when it's necessary, and then so that we can be able to get off that medication even faster.
I've had some friends of mine who are teenagers, and one was telling me, when he looks at a computer for long, he's an ICT person, looks at the computer for long, it kind of triggers the episode. And he could at times he could say, I want to go home, and somehow I forgot to take medication, something like that. It happens, I'm talking about somebody told me, sharing that.
Yes.
Yeah.
Yes, it does happen. And it's true, it actually happens for photosensitive epilepsy. It usually happens for specific seizure types, and for most of them, they tend to happen in adolescence.
Mm-hmm.
So there are those epilepsies that can be triggered by photic stimulation. So, and this is one of the tests that we do when we're doing an EEG, whereby we shine light into your eyes and see whether if we give you light, we will trigger that episode. Yes, but it's in a controlled environment.
Yes.
So that's why it's important to get follow-up and to do these tests so that we know for sure if you're photic sensitive, then we will give you that advice. No, you don't need to go where there is bright lights and all these things, because this is going to trigger the epilepsy. That said, the number of children who have photosensitive epilepsy is small, and again, it's more in the adolescents, but the tests will guide us. We will do that test, and then we will give the advice, this is happening, then you need to stay away from bright lights.
Okay. There's a viewer who is asking a question, and before we go on, we would like to ask the doctor to answer that question. And the viewer is asking, can depression cause epilepsy? Doctor, can it?
Right. So we had mentioned about different symptoms, different things that come with epilepsy.
Yeah.
So usually epilepsy causes depression because if a child is not well managed or is having very frequent epilepsies for one reason or another, very frequent convulsions, then they can actually get depressed. So even when we are managing epilepsy, we usually manage any other mood disorder that can come with the epilepsy, like depression. Now, in terms of other things, comorbidities, what we usually call comorbidities of epilepsy, depression, other mood disorders, hyperactivity, all these things, you can find them in children who have epilepsy. So usually it's a chicken before the egg. So it's the epilepsy and then the depression.
Yeah.
But also you can have them just coexisting, such that in the same child you have epilepsy and you have depression. Yes.
I think in our future episodes we are going to look at depression in children, because I'm also guessing there's some parents who don't believe that a child can be depressed. Yeah, we'll get into that when we get into our future episodes together with you.
Okay.
Together with you.
All right.
Yes. Yeah. There's also another question that the viewer is asking: is shock epilepsy?
Right. So, from what I understood from this question is, shock, kushtuka. Yes.
Yes.
So being shocked. Say, for instance, you've gotten bad news, and then you're shocked, and then you fall down. That's not epilepsy. But then again, I think this brings us to the other topic of things that look like epilepsy, but are not really epilepsy.
Okay.
So a child can be shocked. So let's go back to babies.
Okay.
So you can have a baby who maybe you've made a loud noise, or they are extremely annoyed. So let's say it's a toddler, a 2-year-old, who you're in the supermarket with. The child has told you, I want this chocolate, I want this chocolate. You've said no. So you take maybe the chocolate away from the child. So you notice that the child just takes a deep breath in, falls down, and then does that. Or every single time this child gets annoyed, that's what they do. They hold their breath, and then they lose awareness, they fall down, and then they get stiffening and jerking. So these types of episodes are usually called reflex anoxic seizures. So it's just breath holding. You can hold your breath long enough and induce an episode. You can. Yes. So there are things that look like epilepsy, but they're not epilepsy. And I think the most important thing is, if you're able to take a video, as we talked in the previous section, if you're able to bring a video of that event, I know it's hard. As a mother, you're seeing your child having this, what they're doing, and you're like, okay, how am I going to just remember that information that you give us will help us give you the diagnosis. If you take a video, just a quick one, and then we'll be able to tell what exactly happened. And even when you're retelling the story to us, we will ask you this question: what happened just before this episode occurred. So there are usually very many types of movements that the child may have that are not necessarily, epilepsy. There are movements in autistic children. How autistic children can have different types of movements, hand flapping, that are not epilepsy. There are things we call tics, whereby you can just have movements of the head, movements of the hand that are not epilepsy. So being able to give us these videos will help us discern what we're actually dealing with.
So, like, how many videos would I? Because they might present different things. So I can take them as they come and then come to hospital.
Yes.
Go to hospital. Yeah.
So what I advise parents is, if when that episode is happening, definitely take a video. But if say for instance you notice that the child has this behavior that happens at a specific time of the day, then you can just take random videos at that time. Maybe it's in the morning, maybe it's in the evening. Just take random videos, and then if there is nothing, you can delete it so that your phone storage is not full. But then if there is something, then you store it, and then you come and tell me, okay, so this is what I saw. This is what I've been seeing. What is this? And then now we can be able to hold a conversation and find out what is actually happening. Yes.
The other question that the viewer is asking is, can stroke cause epilepsy in children?
Yes. So stroke can definitely cause epilepsy in children. In the previous section, we had talked about the causes. So there was the group where we had said structural causes. So in the structural causes, other than tumors, we also have vascular causes. So the vascular causes, if you have vessel problems, if you get a stroke, then you get a seizure because of that stroke. So yes, it is a well-known cause of stroke. And I think one of the saddest things is missing a stroke, and thinking that children don't get strokes. They do get strokes. So if you see a child who actually has a stroke, I'm sure all of us have seen an adult with stroke. The hand is usually like this, pumping on one side.
The mouth is
exactly deviated. There's could be drooling on that side. Then it's important to get medical attention so that the cause of the stroke is known. So that if it's a recurrent cause, we can be able to stop that cause. And then also so that we can manage the weakness on that side and the epilepsy that usually comes for most of the children who have stroke.
Okay. So I guess our viewer is getting what Dr. is saying, and which is very, very important. And thank you for those questions that you've continued to ask us. And remember, we are still seeking for more of your feedback on your questions and how you define epilepsy in children in your community, in your village, in your town, in your city, and let's hear what you are saying, because we're here because of you. We are here to share this information. Daktari,
yes,
there are so many misconceptions about epilepsy in children. Huyu ni kisirani, just the way I had said earlier.
Yes.
Ni kisirani. What are some of these misconceptions? Because I've even heard sometimes when you see a child conversing, sometimes there are many things that the parents do. But I think we probably first start with the misconceptions. What are these misconceptions in our communities about epilepsy, and especially for children?
Right.
Yeah.
So one of the misconceptions is that epilepsy is not treatable. Epilepsy is lifelong. Yes, there are some epilepsies that are lifelong, but usually, as we said in children, 70% of them will, get treatment and get better.
Yeah.
So that's a big one. So in terms of treatment, kindly take the child for treatment, and it doesn't mean that is going to be, it won't be that for the rest of your life, no. Another big one is that children with epilepsy have intellectual disability or have a mental illness. That is not true. There are some children who could have epilepsy and intellectual disability or mental illness, but it's not always the case. So you can have a very bright child who just has epilepsy, and it doesn't mean that there's something wrong with their functioning. their cognitive function. So that is also a big misconception. So a child with epilepsy can live a normal life, can go to a normal school, what we call normal. They can do what every other child can do. And then there's this thing that a child with epilepsy, some parents decide to lock the children in the house. They don't.
Very sad.
It's very sad.
Yeah.
So just know that a child with epilepsy can live a normal, full life. Nobody walks around with the name epilepsy on their forehead.
No.
So you can't actually know.
No.
Yes.
No.
So with good management, they do anything. They can go for swimming. So as long as in the pool where they're going for swimming, that there's a lifeguard. There's really no reason, in a well-controlled child with epilepsy, there's no reason why they shouldn't go for swimming if there's a lifeguard.
Yeah.
They can go for trips with the other children. They can go play. They can do all these things. There's also the misconception that epilepsy is due to, witchcraft, or somebody in the family didn't do what they were supposed to do, or you married the wrong person.
I think you need to just look into the camera, because I guess some of our communities, we talk about that. Probably you can just look into the camera.
Right. So yes, there's that misconception that some people feel that it's the wrong. You are told not to marry this person, but then you married them. So this is a curse. It's a generational curse, or you did something wrong, or your parents did something wrong. No. And the problem with having this thought is that you will not be able to go for the treatment that is needed, because you will think that, okay, so if this is a curse, let me go and say sorry to whoever it is. Let me go make peace with whoever it is that I've been told I wronged, or my parents wronged, or my cousin, or I wasn't given the name I wasn't named after this person, that's why the child has epilepsy, so let me go change the name. What I say is, please get the child the treatment that they deserve. This is an organic disease. It's from the brain. It's the cells that are firing excessively. So even as, maybe it is a must for you, probably in the community that you come from, for you to follow traditions and do things and get apologies from people. But even as you're doing all that, take the child to hospital, get them the treatment that they desire, that they require. And that is their actual right. Yes.
Yeah, because that can be common in the
is.
communities. So somebody, as you've properly put it, that even if they are going to do that,
yes,
because we cannot dictate on what they do,
true.
But make sure that the child is attended to.
That is
by
true.
The health practitioner, by
Yes.
the doctor, daktari wake. So let's continue with the misconceptions.
Yes. So in terms of God helps those who help themselves. And the step of actually going to see a specialist in something is a step in the right direction, because God placed us here. I did not, He knew that I was going to be in this position at this time. And He placed me here to help people who have a certain condition.
Yes.
So if we say that, no, we're not going to go to a doctor, let's just not do that, that's not the correct thing, because his purpose is for all of us to live a healthy life. So even as we pray and we need to actually go to hospitals and allow this doctor, for God to act through these doctors, so that they can be able to help you and your child get the treatment that is required.
Doctor, I can agree with you totally in terms of what you say.
Yes.
God desires that we live healthy lives,
yes,
even as we progress.
Yes.
And that is biblical. It's a scripture.
Yes.
In John 3, the letter of John, it talks about how He desires that we live healthier lives. So it is actually what you're talking about. And placing a pediatrician who is a neurologist, who has this skill that are given by God. It's for us so that we can live in our children healthier lives. You cannot put it better than that. It is correct. Yeah. Tuendelee.
Yes, so now other misconceptions occur in terms of when you're actually having the seizure. If the child is actually convulsing in front of you, many people go like they want to put something in the tongue, in the mouth, so that they don't, probably bite themselves or something like that. So the problem is that when you put something in the mouth, you can actually break teeth. Yes, it can also be a swallowing risk if you put something in the mouth. So please don't put anything in the mouth when a child is convulsing. What you just need to do is, if a child is convulsing on the floor, just make sure that there is nothing that is near the child that can harm the child. Let the convulsion just end or you can carry the child as you go to a hospital when you see the child is convulsing. But the idea is there is nothing that can harm the child around. Usually most convulsions take less than 3 minutes. So what you'd be having to do is to make sure there's nothing that can harm the child as they're jerking, so that they're not harmed. Then there's this, or trying to hold them down. Some people try to stop it. So even if you hold this baby, it will still continue. Yes. So
leave them
be
for the 3 minutes.
Yes, leave them be. Yes, you can be carrying them, to the hospital, but you're not trying to squeeze them so that this episode stops. It will not stop because you're squeezing them. Don't try to put them in anything in their mouth. I think I've met so many parents who want to give them water. Yes, the child is convulsing and they're just trying to put water in their mouth. Don't put anything inside the mouth. Don't put water. The problem is choking. You can choke on whatever it is that you're putting in the mouth. And then the other misconception is that the tongue is, you're going to swallow the tongue. You will not swallow the tongue.
It will remain where it is.
It will remain where it is. Yes. So the idea is make the baby safe, but then head to a hospital. If, say for instance, because as we've said, most convulsions will end in less than 3 minutes, and if after the convulsion the child now sleeps, just put the child on the left side. Yes, so that in case they vomit, the vomiters doesn't go to the lungs. Yes.
Left side specifically.
Because it's the way that the trachea and the bronchi, the airway, is positioned. Because if you put on the left side, you have a lesser chance of that vomiters going to the lungs. Yes. So once they go into this deep sleep, then just turn them to the left, and position them in the left until they wake up. Then after that, they'll be fine. Usually you can take them to hospital, or if you're on the way to hospital and the convulsion has ended, just let them lie on the left side. Yes.
I think that's very important. That's very important. Yeah. Any other misconception?
Other misconceptions, I think, is so it could be about the causes of the epilepsy, the fact that epilepsy is untreatable. No, it's not untreatable and it's not forever. And I think we've gone through the traditions.
Yeah.
People thinking that there's something that has caused it that you need to sort out with people. Yes, so I think those are the big ones that usually we try to tell the parents that no, if the child is having a convulsion, please just take the baby to hospital, manage the child at that time. And also just know that sometimes some epilepsies, they can come with other conditions. So if you're treating, say, an epilepsy and the child has hyperactivity, for some children, when you treat the epilepsy, you may notice that the child's hyperactivity has reduced. Yes, so management of epilepsy is sort of in a multidisciplinary kind of way, and it's wholesome in terms of if we manage one thing, and you say, as one of the viewers had asked, is if there's depression, then we can be able to manage the epilepsy and the depression. Yes.
Before we close that time,
yes,
I have had some parents, and you mentioned it earlier, that they will lock their children in their houses. They don't want these children to mix with others. In school, they deny them to go to school because they're fearing they will have the seizure in school. And also, I guess because of probably stigma, because this child, converses. So I don't know what you would say about that.
All right. So in terms of the thought about epilepsy, I just want to let everybody know that epilepsy is very treatable. Epilepsy in children, for majority of children, they do not need the drugs lifetime. We can treat them and then actually get them off the medication, and they can live the life that they were purposed to have. So making a child not seeking medical advice for a child and locking the child at home is really unfair. It's against their rights as children. So kindly, if you notice that maybe a neighbor has locked the child in, and sometimes it's just because they don't know. So I think we can all strive to be the ones who give this information to our neighbors. Let them know that these conditions are treatable, especially in children. Most children will just get better if they're treated, if they're managed the correct way. And most epilepsies in children actually resolve. So you don't have to worry about it, later in their life. So in terms of locking the children in, I think we just need to give that information. I think there's another question you'd asked.
It was about the stigma.
The stigma.
Yeah.
Okay. Yes. So in terms of the stigma, epilepsy, there should be no reason why epilepsy is like any other condition. It's like this child has it's another disease that can be managed, and if managed correctly, we don't have to really worry about it. In terms of, if you get the correct management, this child can live the life that they want. They can do what they want to do with their life. If this child wants to become, a healthcare professional, wants to become a musician, they can do what it is that they want to do and live a full and healthy life. We just need to give them the tools by getting them the management they require, and then making sure that they don't get these repeated episodes. And when that time reaches, when we say this child has remained seizure free and we can now remove the medication and remove the medication successfully, it's a most amazing thing. It's a most amazing thing. So I think let's give every child that chance.
Yeah. So parents, let us not hide our children. Let us treat epilepsy just like any other condition, any other illness, as Daktari is saying. And Daktari, your parting shot.
Yes, so my parting shot is that epilepsy is quite manageable. A majority of children will not, when treated well, will not need treatment for the rest of their lives. And together we can be able to fight this disease, which is like any other really, and be able to have healthy children who can become and do anything that they want to do in life. Yes.
Asante sana. Epilepsy in children is misunderstood, and I want to believe that what Daktari has taken us through, it will be of help to you as a community, as a parent, or as parents. And I believe that we can be able to support these families, and the children can live their full lives as God intended them to be. Before we close, Daktari, where can we get you? Because we may want to bring our children that are presenting the symptoms that you have shared with us today.
Okay.
Yeah.
So you can get me at Kiambu Doctors Plaza. So the contacts of the clinic will be placed just on the screen. So you can call that number and make a booking, and we'll be happy to see you. And we hope that all the information that you've gotten today, you can be able to spread to your colleagues, your friends, your neighbors, so that we can demystify epilepsy.
Okay. Asante sana. Asante sana. Nimesema hiyo sijui mara ngapi, but it's very, very important, and thank you so much for your time and for honoring us with this information. And I believe that our viewers are going to be helped. and they're going to know when to seek help, because this is one of the areas that they may just look at it and just dismiss it and like ni mtoto ana misbehaving. So I think this is very, very important, and I thank you so much for honoring us and coming to this episode. As I said earlier,
yes,
we are going to have many others,
okay,
so that in our next episode, and I would like to, because I've already requested Daktari, we'll look at autism. We'll look at autism in our next episode with Dr. Maureen. And thank you so much. Our viewer, thank you so much for being with us in this episode and this very important area of epilepsy in children, handling it with Dr. Maureen, who is a pediatrician neurologist. Thank you so much. Until next time, God bless you and enjoy yourself, and make sure you spread this information to other people. Bye for now.